afternoon to our friends who are joining us for today's webinar on high quality case management, the key to safety and improved outcomes. I'm Lisa Silverman and I'm your facilitator for today. We're so thrilled to be joined by this great panel here that we have from the URAC team. I'm joined by Dr. Karen Watts. Karen, you gonna wave and say hello?
Hello.
I'm joined by my colleague, Monica Dantzler-Thomas.
Hello.
And from the CMSA team, I'm joined by CMSA President, Melanie Prince, who's with us.
Hi, everybody.
We're so looking forward to a great conversation today. We're going to focus a little bit on what does it mean to be a leader in case management? What does case management look like at this point, a year into COVID, and how technology has changed case management and impacted? And we're going to talk about professionalism in case management. Every person here is a professional case manager. So we're looking, or is in the case management field or associated with the case management field. And we're going to talk about how professionalism in the field of case management elevates the profession as a whole. Karen, I'm going to turn the floor over to you to give us a little bit about URAC. Tell us what we do and who we are for those people who may be new to URAC.
Excellent. Thank you so much, Lisa. And again, I'd want to add my welcome to everyone on this webinar to the high quality case management, the key to safety and improving outcomes. So a little bit about URAC. URAC has been around since 1990. We've been an independent nonprofit leader in promoting healthcare quality and patient safety through recognized accreditations, certifications, designations, gives organizations an opportunity to fulfill that. We provide processes that prepare organizations to innovate and thrive in the healthcare arena. Our reviewers are all clinicians with an average of about 20 years experience in the healthcare industry. Next slide, please, Lisa. Thank you. You know, as I said, you know, URAC has over 30 years experience in providing programs with evidence-based standards. Those standards were developed through a collaboration of stakeholders and industry experts, such as the Case Management Association of America, CMSA, who's here today. And I want to have Melanie join me and just kind of give us a brief overview about what CMSA does and who they are. Melanie?
Thank you, Karen. And again, welcome to everyone for participating in today's webinar. I'm really excited to be here to represent Case Management Society of America. And like URAC, CMSA was also founded in 1990 with the sole commitment just dedicated to supporting case management, to develop the profession of case managers. We do this by presenting educational forums. We have developed a very extensive networking community, and then we're very involved in the legislative process. So as an organization, we're also a nonprofit member association. We have a structure where there's a national office, board of directors and officers. And then we have about 75 chapters throughout the USA and a few overseas as well. And all of them are affiliated. And it gives us a structure that allows for both horizontal and vertical support of the case management profession. You know, recently we did a state of the industry survey. We had about 600 respondents, and of those 600, 85% of them were certified case managers. So I want everyone listening to know that CMSA is an organization that absolutely values certification. And that is something that we have in common with URAC. We've been really busy this year, as everybody knows. Last year was pretty tough, but I just would like to share as I come to the conclusion here about CMSA, a little bit about CMSA. We've been really focused on developing our educational programs. We want to fill that knowledge gap for case management professionals. We have worked really hard to pull together, again, that networking and address some of the needs of our case management professionals as a result of the pandemic. So that's been great. We are planning a boot camp that we hope to talk about at our conference that's just around the corner, June 7th through 10th. So definitely check that out. We have a very robust and active public policy team that's working on mental health initiatives, telehealth, and just workforce development. So we are really focused this year to make sure we get the word out about what CMSA is doing for the discipline, the profession.
Melanie, thanks so much. We are thrilled to have you here. And at the end of the webinar, we're going to spend a couple quick minutes talking about the official partnership between CMSA and URAC. But also, I want to make sure I acknowledge there's so many people who do case management, and Monica's about to talk about this. Thank you, especially, we know it's National Hospital Week. We know we just passed National Nurses Day. Thank you to those of you. We know the last 15 months we're going to talk about this. We've been talking about it. But thank you for all you are doing, whether you're on the hospital or the nursing side. We saw a bunch of you coming in. So thank you for that. We've asked Monica Dantzler-Thomas from the URAC team just to give a little bit of an overview, just to kind of make sure we're all on the same page when we're talking about case management. What are we talking about? She's going to give you a quick overview of URAC's case management accreditation, and then we'll dive right into the discussion. If you have questions that you would love for Karen and Melanie to touch on, please put them directly into the chat box. You can do it either to all panelists or to all panelists and attendees. We'd love to see those questions, and that can even help guide our discussion. Monica, the floor is yours.
All right, thank you, Lisa. Good afternoon, everyone. My name is Monica Dantzler-Thomas. I'm the Director of Care Management here at URAC. Welcome, welcome, welcome. I'm going to talk to you all briefly about three things. I'm going to talk to you about what is case management, the role of the case manager, and the URAC's case management accreditation. What is case management? Well, case management is a collaborative process that connects clients with resources to obtain their optimum level of wellness, self-management, and functional capability. Case managers look at the entire clinical picture and develop a cost-effective plan based on the clinical, based on that patient's clinical picture. Role of the case manager. I'm going to talk about four things, four elements of the case management role. However, we all know that this is not inclusive. Our list actually expands a lot longer, but for the sake of time, I'm only going to discuss four. I'm going to discuss the case manager as collaborator, coordinator, facilitator, and regulator. And I use that term regulator very loosely. Case manager as collaborator. Case managers collaborate efforts among members of the multidisciplinary team, service providers, and caregivers. Coordinator, case manager as coordinator. We work with insurance companies to get inpatient and outpatient services approved. We find resources for uninsured patients, and we can coordinate services between providers. The case manager as facilitator. Case managers facilitate the patient transition from one level of care to a lower level of care. And the last one, and I said I'll use this term very loosely, the case manager as regulator. Reimbursement documentation. In some areas, the case manager and the UM department either work very close in concert, or the case manager may perform both the case manager and the UM function. So making sure that the documentation is very tight and it meets the criteria to obtain reimbursement from the payers. So we are, in addition to that, we also educate the medical team on the criteria for admissions and readmissions. Working in the case management space, and I can actually allude to this, it is a very, I'm passionate about it. It has been a role in which I have thoroughly involved. I have thoroughly enjoyed over the years. I have seen the involvement of case management. And I will say that looking at the different roles that we play and paralleling those roles up to the guiding principles of case management has really had a positive impact on the case management profession. And that's going to lead me to talk to you all about the URAC case management accreditation. First and foremost, what I want to say is accreditation is about performance and quality improvement. Accreditation signifies an organization's evidence-based practice, clinical practice guidelines, and adherence to industry standards. The URAC case management accreditation one of the things that we pride ourselves on is making sure that our standards are parallel and we integrate industry standards, evidence-based practice guidelines, and we also ensure that we are also maintaining a pulse on what's going on, not only in the legislative space, but also in the regulatory space. So we always want to make sure that our programs are up to date and we can provide the optimum program to make sure that our clients are in line with those type of standards. In addition to the case management accreditation, we do have some supplemental designation programs. I kind of look at the case management accreditation as the entree, and then the supplemental designations as your dessert. What is a good meal without a great dessert to follow? And so with that being said, we have the opioid stewardship designation, which provides a framework for organizations to demonstrate their commitment to patient safety of opioid medications. We have the measurement-based care, which is designed to improve outcomes for patients, especially those with mental health substance abuse. And then we have the transition of care designation, which is a testament to your organization's commitment to best practice. Okay. Thanks, Lisa.
Thanks, Monica. At this point, I'm going to stop sharing, and I'm going to ask Karen and Melanie. Their cameras are back on. We're here for some great discussion and connection. And let me also acknowledge, Karen, I owe you a thank you. Like you said, our president CEO, Sean, had to go out of town suddenly for some URAC business. So we are thrilled that you're stepping in on this role here. Melanie, we want to know a little bit about you and your journey. You've had this great journey through the case management world, including a good chunk of military experience from which you're recently retired. Tell us a little bit about this and how did you get into it? What made you say, I want to do case management?
Oh, absolutely. Happy to do that. So I was commissioned into the United States Air Force in 1989 as a second lieutenant. I began my military career as a military nurse in the beautiful Fort Walton Beach, Destin area, assigned to Eglin Air Force Base. And this was an internship, right? So I spent my first 7 years really honing my skills in the emergency department, inpatient units as a nurse, medical surgical care of patients, and then urgent care. And then I was selected to attend university full-time to get my graduate degree. And I was approved for adult health nursing, but when I arrived at the University of Arizona, they were about to launch a case management track. So of course I attended that seminar and listened, and I realized that this was absolutely the program for me. It was a program that was going to equip a nurse with all aspects of the clinical and business side of healthcare. It was going to provide a way to take care of not just a patient's clinical picture, but everything, all of the other domains that surrounds a patient's life as they're coping with health strategies. So I was really excited about that. So I was able to get my degree in adult health nursing case management. So I will tell you that while I certainly enjoyed medical surgical nursing, it was kind of a finite thing. And I like to use a cancer center as an example of why case management was different and why it meant so much to me. When I took care of patients with cancer, of course, they would be in their inpatient setting, they'd have their surgery, they'd go home. As a case manager, I got to meet a patient at the very beginning of their diagnosis, even at the time of screening, be with them throughout the decision-making process, all of the touch points that they had to make throughout their journey of care. I worked with them with their finances, spirituality, all of their relationships, all of the changes that you can imagine with someone coping with a life-altering diagnosis. What I like to call that end-to-end through transitions of care and all of that. So, it was absolutely the perfect fit for me, Lisa. I really, really, really enjoyed my time in university and all of the opportunities I had following that.
That's outstanding, Melanie. Thank you so much for that. And you and I, of course, we've spoken before. We are both retired military, both retired Air Force. And as we go through the Air Force, we know that we go up in different positions and get into leadership jobs within the military. And then as we exited into the civilian life, we've done that. So can you tell us some of the volunteer efforts or roles that you've had that helped lead you to be the leader of CMS?
Oh, absolutely. Let me tell you, I was so lucky to have mentors early on in the mid to late 90s. I attended a utilization management conference, as a matter of fact, in California. And then that I started to attend the Case Management Society of America conferences. In fact, I have been a loyal attendee for every year since 1997, except for 1 year. So I have been involved with CMSA for many, many years. I had the good fortune of serving as the treasurer, vice president, and president of a local chapter in Washington, D.C. And then in 2004, I was selected as the case manager of the year. And when I received that award, I made a commitment at that moment to do whatever I could, play whatever small part I could play in ensuring the ongoing success of CMSA. So I ran for director positions. I had the opportunity to serve as a military advisor to the national board. I had a chance to start a group. It's a pre-conference for the Department of Defense Military and Veterans Administration case managers. We meet the day before the conference. We network, we share information, we receive education from various speakers. We advance the strategic agenda of the surgeons generals of the 3 military departments and the VA. And it was a way to come together to really focus on military unique issues surrounding case management. So I was really proud to get that started, and we're still doing that today. And then, you know, I'm coming on the end of the career. You know how that is, Karen. Yes. You're kind of thinking about what are we going to do next? But all along, I'd hoped that I would have the good fortune of serving as president of CMSA. So I took that leap of faith and was very lucky and blessed and fortunate that the members of CMSA elected me to serve, and the timing was perfect. I was elected the last year of my active duty, 30 years, 4 months, and 12 days, if anybody's asking how long I was in the Air Force. So my first year as president-elect was my last year of active duty. That was 2019. And then last year, I received the gavel from the previous president. And like I said, the timing was great because it gave me a chance to really just kind of dive into this without looking back, full time, and really, really be in a good place to serve. And I serve with amazing people, a great board of directors, wonderful officers, you know, committee leaders, task force leaders who are volunteering. We have a great national team as our association management company. And it's been amazing. I'm really excited that I have this opportunity.
Excellent, thank you.
Thanks so much, Melanie. And I hope you can see, I know on the side, you'll see a lot of kudos coming in to both of you for your service and for your time in it. And we even had a couple of other people who chimed in saying that they are there. So I want to acknowledge that our first question came in from Michael, and he asked, what are key trends in innovation in case management? And we're about to get into that in this next part of our conversation. I'm going to ask you to keep that in mind. And also, I'm going to ask the audience to answer that question in the chat box as well. We'll send it back to you. We want to hear what are some of your thoughts on trends and innovations in case management. And Melanie and Karen are going to get into that in just a minute. Melanie, we're slowly starting to come out of what's hopefully the worst of the pandemic. I know today is my second shot plus 2 weeks day. And I think anybody who's had that second shot plus 2 weeks day, we know the freedom of that. I told Karen the other day, there was some joy in picking out my own bananas at the grocery store for the first time in more than a year. Let's talk about, we can't ignore the pandemic. We know people are thinking about moving on. We can't ignore the pandemic, but how did the pandemic affect the field of case management? What changes had to be made to ensure continuity of care? We know that actually people put off preventative care. How many of us can raise our hands and say, I am behind on at least one of my preventative care medicines. How did the pandemic force case management, the field, and the individual case managers to adjust?
I think that's a great question. And of course, what I will say is based on my opinion, based on anecdotals, based on talking to so many of my peers. I'm always thinking about science. This is nothing I say is going to be based in a scientific study, right? So absolutely can't generalize it, but just the information I've gathered over the last year really led me to focus on one area that I think I'll share it in answering that question. Of course, the pandemic affected the entire industry, but one area of case management that I heard a lot about was how case managers were, asked to transition from case management and go back to their core nursing or social worker role. Yes, the facilities were stretched, they were maxed out. There were some furloughs to kind of offset some of the profits that wasn't coming through on the profit line side, on the product line side. And while this may be considered a negative, I saw it as an opportunity to really work towards something I think case management leaders have been trying to do for a long time, which is, case management shouldn't be administrative overhead. It should be on the other side of the equation, part of the product line that really helps the organization in terms of quality as well as financially. So as I think about what happened last year, when I talk to the team, I'm always talking about strategy and what is it that we can do to support our profession such that we can be data miners and aggregate this information so that we can absolutely validate that case managers affect the clinical quality of patient care, but we also have a direct impact on the bottom line of an organization. So that's something that I'm taking away from the pandemic, that we should continue to be case managers through a pandemic or a disaster. We should not forego that role, but our challenge is to make sure that organizations understand what impact we really, can have. So that would be my contribution.
Absolutely. And, thank you for that, Melanie. One of the things, too, I think we need to also think about is, as someone who has had case managers that have worked for her through the years, you don't realize how diverse the case manager can be until they're put into the situation that they need to kind of think outside of that box and come up with new ways to make sure that their clientele is receiving the care, the services, the medication, the appointments, those things that they need to keep that individual on a healthy path. And I think when you look at the COVID, what you have seen is that case managers had the opportunity and stepped up to make sure that they're keeping those bonds between their clientele and the healthcare arena, so that they're getting in to get those specific types of cares that they need. So the flexibility of the case manager can be seen, and I think Monica spoke to that earlier when she talked about the role of a case manager, is that they have to be able to, when necessary, flip on the dime and be able to know what's going on in the environment and be able to move that patient through that system so that they can get the care that they need. The COVID pandemic has challenged everyone to be able to think differently, to be able to react differently. And so the case management, I think anyone who's had the opportunity to go through any type of additional schooling or education, glean those skill sets to allow them to be able to do that. So I think COVID has not only shown the importance of case management, but as Melanie said, take it off the back burner and put it up front when we're talking about getting them funded.
So as we talk about trends and innovation here, we've seen, let's not ignore that throughout all of this, we've seen a huge growth in technology. And how technology is playing the role, both telehealth and remote patient monitoring. And we know that telehealth and remote patient monitoring were growing prior to the start of the pandemic. But how has it played a role? And Karen, I know on the URAC side, we've really grown our programs there so much, but how has it played a role? How has technology played a role in case management? And how has case management shifted because of technology? And what role do you think or hope technology is going to play going forward?
Oh, absolutely. Thanks. So, the thing about telehealth, URAC has been looking at telehealth and providing an accreditation for about 2-3 years now in that. And the COVID pandemic just kind of spearheaded that. Believe it or not, case managers have been using some type of telemedicine in the course of providing care to their or services to their clientele, from being a telephonic case management to being monitoring of those remote systems or devices that the patients are required to wear, to give them the information on what types of services, what new issues that need to be addressed. So it's nothing new per se for a case manager to use technology to be successful in what it is they do. However, it does now lend itself to be able to be more advanced in providing a better way of collecting the data, being able to connect with the patient. And that's what we're seeing now, is that there are more platforms that are being developed to allow individuals to use them to provide care to the patient. So I think as we go forth, we're going to see more of that, hopefully. I think as we all know that the big reimbursement again is on the horizon. How do we get reimbursed so that we can continue to provide the care that needs to be provided to those clients? Those are the things that we're going to have to make sure and work through and make sure that we are forwarding so that that goes forward and does not go back to where we were at. Melanie, what are your thoughts?
Well, actually, you really covered that very comprehensively. I agree with everything that you just said. Of course, telehealth, telemedicine, as you said, has been around a long time. I think for case managers, one thing that technology has done as a direct result of the pandemic, we've been able to use these virtual communication platforms to not only connect with our patients, but to connect with each other. I mean, I like to say that innovation is in the DNA of every case manager. And what the pandemic showed us, though, that when the resources really dwindled, we needed to connect in a larger way. We needed to expand our influence. We needed to expand our reach. And I think the virtual technology allowed us to do that. We were able to go across county lines, across parish lines. If you're from Louisiana like I am, we have parishes, not counties. And we were able to share information across state lines. And so our chapters started to really come together and form these regional networks. Cmsa was able to facilitate that. We were able to create the conditions such that that could happen. And so all of a sudden, I had the information I needed as a case manager to really figure out how to help a patient because of the use of technology. And I think that was really evident this past year, in addition to everything that you just said. I will say that I'm still a big believer in personal engagement, interpersonal interactions with patients, but I do fully embrace the concept and idea that technology should complement our practice. It should be an adjunct. We should use it to really collect that data and elevate our ability to take care of our patients.
Karen, we speak that line a lot around URAC about, I hear Dr. Griffin, Sean's voice in my head saying, bad medicine on a fancy platform is still bad medicine. So how do we use these tools for good? How do we make sure that we're still having that personal connection, not just here are your test results, but dear so-and-so, please contact me with any questions, and still making that, I think, case management's got so much of the heart there and the problem solving and I want this to work for you. And I'm seeing the bigger picture of it and being able to use those tools for that. Raina, I so appreciate you chiming in here. You said case managers have become like project managers of a firm. And you said, I think case managers can really help automate the right process. Melanie or Karen, do either one of you want to speak to that about the case manager really being so in the process that they can actually see what needs to happen?
Oh, absolutely. In fact, in one of my prior jobs that I had, greatest thing to do. Over the Department of Health in DC, the case managers went out to do the home visits. And one of the things is, you know, you always get stuck with that paper. Okay, how do you carry around all the papers you need to do? And it gets cumbersome. So one of the things that we got together to do is to actually develop a case management system for all of the case managers. So instead of paper, they were now walking around with laptops that allowed them to keep the information about their clients within their folder, so that as they go in, they can see the services they provided, what is it they need, what is the plan of care, how are they doing that? So, and the case managers are the ones who help to develop that by talking about the functionality that was needed in those systems. So as they're going in, should they use a checkbox or should they use a box where they're actually documenting and providing the information on there? So that system that we used helped us to not only document better and keep information safer, but also reporting of outcomes became a lot easier. So that was absolutely correct. Case managers do have a role in helping to develop those systems to help show it is what the outcomes from case management is actually occurring.
Melanie, I think I see that you have some thoughts on this here too.
Yeah, you know, to add to that, anytime you're talking about automation, that inherently brings to my mind process improvement for efficiency to do things smarter and better. So what's been really great, I spent the last, I would say 5 years or so prior to my retirement in the Air Force, trying to bring Lean Six Sigma types of process improvement principles and strategies into the practice of case management. Any case manager that's listening will tell you they don't have enough time in the day. There's a lot of paperwork. And even when there's automation through the tablets that Karen just described, there's still a lot to do. And so if you start to think about your practice from a lean perspective and you start to figure out, you know, better ways to do things, eliminate the wasteful things, the things that aren't useful to you or your patient, case managers can really be at the forefront of making this better. And I know URAC is all about process improvement, but certainly in the case management field, that is something that I have really put some emphasis on in the last 5 years. So thank you, Karen. I totally agree with everything you just said.
Thank you, Melanie.
Diana, I want to echo what you're saying here. I think about this, all of us on a daily basis are using some form of electronic communication, whether it's a social media app that we like, a website that we always follow, something that we're constantly checking out. So it's really nice to see that we're bringing those tools in. I think about it, Karen and we have overlapping working experience working with the health department, but I also think about it in how does that allow that transition to happen? If one of your case managers suddenly gets sick or they have to take care of a family member, because that happens, the paper file is not with one person. It allows for that care to continue. And while we feel also, you know, so much empathy for the person who can't continue in that case manager role, how does that enhance the patient experience?
Oh, absolutely. You know, continuity care and to be able to continue through, even if, for heaven forbid, you know, a case manager gets sick and someone else has to follow up with their clients, the ability to have the access to know what's going on with the client and step in so that it is seamless to the patient, seamless to the client, allows that client to feel comfortable in continuing through their health journey. So that becomes very important, and I absolutely agree that there has to be a way to maintain that ability so that there's a seamless care for that client to do. And technology is the best way to do that, absolutely. Papers get lost.
Melanie, any thoughts there?
Well, I also think that technology affords an opportunity for the patient and the client to communicate with us. I mean, it gives a way, it provides a platform for even further engagement. I had an opportunity to participate in a panel last week with an international group, and they talked about how there's a strong desire for technology to be a part of the case management practice. Of course, there's challenges with internet and all of that, but they talked about that value. And one of the things we really tried to hone in on is how can we facilitate the client, the patient's ability to give us the feedback, to give us the information through those devices so that it's almost real time. We don't have to wait for that weekly phone call or that weekly visit. You can get information faster, more efficiently, and directly from the patient. So I think that opposite perspective is just as important.
It's that collaborative care, and that's going to get us into this professionalism, right? How does collaborative care help with the professionalism? And we and Karen, I'm going to start you with this question, but both URAC and Cmsa have support programs that really promote professionalism and best practices and high quality. Why are these programs important to patient care? I think we all kind of know the answer to that is that they improve the quality of care, but why so much in this that it's so important to patient care to have that level there?
Healthcare is based on evidence based findings, and the ability for individuals to find the best way, and I say that best way, of how to do services, how to help a client, how to provide some type of treatment. Accreditation allows you to do that, in that you're looking at what is going on within the industry and identifying the best standards that everyone should be at a minimum be meeting as they are providing case management services. So when we look at accreditation and we look at what it is that we're looking at, where's your quality program? Melanie spoke about the quality of keeping things in place. What are you looking at from a risk management? Are you following the laws within the state that you're in? Do you have a program that talks to exactly what type of services? We know that case management is a wide variety, from the medical side to the behavioral health side. Are you concentrating more on the behavioral health side, that mental health? And if you're concentrating more on that side, what is it that you're doing within your program to be able to meet the needs of your clientele? So understanding that using a standard, nursing, just to be a nurse, you know that there is theory, there is standards. So putting all that together to make sure that we are providing the care is something that is very important in healthcare. So accreditation takes that much further. So you have the ability to innovate. You have the ability to say, you know what, we have this problem, and here's what we are going to do about it. And then improves the services. And hopefully what that will lead to is an increase within the industry to allow others to learn from you. So that's the importance of making sure that we're promoting professionalism and promoting those standards out in the industry. Your thoughts, Melanie?
Yeah, I think that's great. For me, professionalism sets it's an expectation that's set in terms of competency, in terms of knowledge, skills, and abilities, what I like to call the KSAs. It ensures the confidence in one's ability to do something in a way that's benchmarked against a set of criteria, right? And I don't know about you guys, but when I'm ready to purchase something or, go to a hotel or restaurant, or whatever, I'm quick to look at reviews, but I'm now beginning to look for that seal. We have the evidence of professionalism, whether it's through educational credentials or licensure, certifications, accreditation, as you talked about, Karen, but we're always looking for that tangible evidence that this entity, whatever it is, has met not only a minimal set of criteria, but even a higher set of criteria that's above the bar. So for me, that's really important when I think about professionalism. And I've spent my entire career trying to advance that concept because, again, it gives you the repeatable effectiveness of what's expected from whether it's a person or an organization.
And what you say also, you know, when we're talking about professionalism, equity of care and diversity, and making sure that as we look at communicating with our clients, we are on their level and not talking above them, but talking to them so they're understanding and they don't feel like they're being left out. What would you say about those?
No, I totally agree. And again, that's part of that professionalism. You have the skills to understand that, you know, emotional intelligence, for example, is important. Diversity and inclusion, all of those are important. Understanding cultural implications, all of that's important. And in order to understand that, then it's professionalism that motivates you to acquire those knowledge, skills, and abilities so that you can operate effectively in all of those spaces. So I absolutely agree.
I think, you know, I love hearing that you're talking about this. And Mary Beth Newman chimed in here. I think this is really important because she said, you know, once we can get the administrative stuff down, which seems to bog down. I mean, administrative stuff bogs down any profession. Even at URAC, I'm talking about, you know, how do we automate things like scheduling, right? That lets us actually, Mary Beth says, you know, it helps us be at the top of our license, operating at the top of our license. If we can automate some of those things, we can do more of that important critical thinking that we have to do to actually really improve care rather than just scheduling an appointment. What if that element is easier? What if the transportation is automatically outsourced to a company, to an Uber, and we don't have to worry about, now I have to make 5 phone calls to get that. Now I have to figure out what's the next step, or who needs to be at that meeting. And Mary Beth, I appreciate you saying on there that this is a rewarding part of case management and brings much greater joy and satisfaction. I see the smiles on Melanie and Karen's faces. But let's also acknowledge accreditation and certification take a lot of work, whether you're on the organizational level or you're on the individual level. These are not easy tasks, but people are looking for them. Melanie, you said yourself, you're looking for those seals. Melanie, I'm going to ask you to start with this response, but what do you say to an individual or an organization who may be a little bit hesitant about it? And then Karen, you're going to respond on the organizational level.
Yeah, thank you for that. And I'm going to base it again on my work that I've done in the past with an institution that totally believes in accreditation and standards and all of that. I would say to start with a plan. There's a lot of information. There's a plethora of information. There's assistance that you can get, but you really need to start with a plan. And then I like to advocate for using change management strategies to really bring the entire organization along on the journey. When I was working, I really felt like the power of an organization was at that middle collaboration, the middle managers. You know, they had their finger on the pulse of what was happening at the point of care, but they were senior enough to know how what they were doing would affect, you know, the organization at large. So build a plan, absolutely bring everyone on board. So using change management so that you can start that accreditation process and everybody's on board. That's from the organizational level. And I know Karen's going to talk more about that. As an individual, it is about professionalism. Obviously, individuals are not accredited, but they certainly can seek certification in their practice to elevate their careers. Karen?
Oh, thank you so much, Melanie. And I think, you know, this is probably an opportune time. Lisa, I think we have a slide about accreditation that we can kind of
do
just a little bit. So, you know, all of us have gone, many of us on the phone are clinicians and have gone through schooling. And you start off, it is, before that one, if you could, the actual accreditation slide, that would be great. There's always that opportunity. Thank you. You go through it, you're taking those tests, and the rigor of going through all of that is just so hard. And you look at it, you're just going day by day. But by the time you are done, is that feeling of accomplishment. The same thing happens when you look at accreditation. This is kind of just what URAC's accreditation process looks like. So, we talk about the organization has an opportunity to put together their policies and procedures. And don't get me wrong, this is a lot of work. Like going through any kind of school and like any process improvement, there is some work involved in this. So it is looking at your processes, it's putting it down on paper so that you can document that and provide that information to URAC. And then once that comes over to URAC, that lead reviewer is going to read all of the information that you submit. This is where the education and that iterative process comes in, where the reviewer has the opportunity to say, you guys hit the mark right on there. This is great. We can move on to the next standard. Wait, you know what? On this one, there's an opportunity to just to think through a little bit and provide a little more information on how it is that you are meeting that standard. And then that shows, and you go through the desktop review, and then there's a validation review. Desktop review is you just providing your policies and procedures. That's great. You've got it all down on paper. The validation review shows that you've put this into practice. You're now demonstrating that this is not just something on paper, but something that your organization is actually living through. And then once that is completed, it goes to the accreditation committee, who is a volunteer committee. They have the opportunity to we blind your application, we send it off, they read your application, and they make the determination on your accreditation or what status you will have. And then of course, there's that monitoring piece. The monitoring piece is you've been successful. URAC is giving you full accreditation, and now you're here for 3 years. But the expectation is, are you now continuing through and meeting the standards? The idea is when you get accreditation, you've demonstrated that you've gone the mile, that extra mile to make sure that you have the standards in place. Now it is keeping them in place because that monitoring place is, the monitoring period allows us to see whether or not you're actually continuing to do what it is. So the accreditation process is there to help your organizations. And we've had so many organizations who've gone through that. That's the hardest thing we've ever done, but you know what? We're better for it on the other end.
They're so proud of it when we see it. So Karen, I am going to go back a slide, back 2 slides here. And just as you're thinking about, as Melanie and Karen, you're thinking about what are the closing thoughts? We want to have Karen, I also want you to speak just for a quick minute to our official partnership with CMSA.
Thank you. And, it is our pleasure, URAC's pleasure, that we are in partnership with CMSA. And we are so grateful that they are around the table with us to further case management in the arena. One of the things that we have done is to look at our partnership is individuals that are in CMSA organizations, whether you are the individual making the decision or not, in other words, you're doing your certification through CMSA, but your organization, there is the opportunity of a discount as they're going through accreditation. We see the benefit in our relationship. One of the things that we are expecting to see, and I hope that CMSA is also expecting from URAC, is that we are going to further case management in the arena. And we're going to make sure that as the standards need to be updated, as the standards need to be revised, they will also be at the table to help us as one of those stakeholders that will be providing us with information. So if you are interested, I know that we have some of our sales individuals, just put it in the chat box and we can give you information about that more. We do have a shared belief that case management is meaningful, and we need to maintain those connections for a better long-term outcome.
Thanks, Karen.
Thanks.
Quick closing out housekeeping announcement before I ask Melanie and Karen to finish up for us. If you are interested in obtaining your continuing education units through CMSA, they'll be handling all of that. So look for communication from our partners over at CMSA. We'll have the recording of this webinar up in your inboxes early next week. Let me just, in closing, we've had such a great session. And Monica, you too as well. Thank you for joining us. Karen, I'm going to ask you to start. Melanie, I'll have you respond, and then Karen, I'll ask you to close it out. What do you hope people keep in mind about case management when they walk away? What do you hope they're thinking about in, as they walk away, and then maybe later this evening or later this week?
I would hope that everyone remembers, and I'm sure that they do, that case management makes a difference in people's lives. And the other thing, of course, being the Vice President of Credit and Client Services, one of the things is that accreditation can help make sure that your organization is innovating those processes that you have within your organization, that you would reach out to us and allow us to assist you as you continue on that path. Melanie, how about you?
So I'm sitting here thinking about 3 distinct messages, very short. So I'm thinking about the case managers that are within 5 to 10 years of their career, or nurses or social workers that are about 5 to 10 years in their career. I wanted to encourage them to consider case management as a specialty. It is absolutely meaningful and rewarding. And I just think that the development of the practice is something that I want to continue to focus on. My second message is to employers. I talked a little bit about, case management as administrative overhead. I'd like to challenge employers to really spend some time and get to know, walk in the boots of a case manager and understand what case management really is. And you will be pleasantly surprised that with the opportunity to provide data, to show that value proposition on the entire organization is really great. And then the last takeaway, I hope that, my seasoned, experienced case managers are out there thinking about, the continued development of case management, aligning what we do as leaders with the organizational values and supporting the idea and concept of accreditation, and just being an avid and important member of an association to advance all of those goals. So this has been an amazing pleasure to talk to everyone today and talk with you, Lisa and Karen. It's been really great. So thank you for the opportunity.
Oh, thank you. I don't know if Monica has any closing.
Actually, I do. I echo the sentiments of both you, Karen and Melanie. Like I previously stated, case management is my passion. I am looking forward to the opportunity to sit at the table and work with CMSA. I am a member of CMSA, and I highly encourage the opportunity to make sure that we're in alignment with some of the programs and initiatives that they're working on to ensure that we incorporate that into our business practice as well. So looking forward to a great opportunity.
Thank you, Monica.
Yes.
I have to thank all of you. You all are people who work significantly more than 50 hours a week. Everybody who is attending, I love seeing kind of the heart of this webinar and the heart of the profession. So thank you for being with us today. I have our, if you need to connect in with URAC slides, up there. We have it up there for a second. But with that, Monica, Karen, and Melanie especially, thank you so much for joining us for such a lovely, warm conversation about the importance of the field and where we're going. All right. It was great to work together.
Thank you, Lisa.
All right, thanks.
This officially concludes our webinar.